Good morning, ladies and gentlemen. My name is Shishir. I am from Nepal. I work for the Ministry of Health and Population. And the topic of my presentation today is Tele Motherhood pilot project in Rolpa district of Nepal. This project is all about using mobile technology in the health delivery service to improve the reproductive health of pregnant women. This project also explores the possibilities of information communication technology as a tool to improve service delivery in resource low setting. Rolpa district is one of the remote districts of Nepal with high maternal mortality rate as compared to the remaining part of the country. Maternal mortality rate in the Rolpa district is 352 in 100,000 live birth. Fourth ANC visit is only 90% and institutional delivery is merely 5%. If we look at the national data, maternal mortality rate in Nepal was 515 in 1995. It decreased to 445 in 2000 and finally it became 281 in 2006. And we can clearly see from this data that the maternal mortality has significantly reduced in Nepal. But there are many districts of the Nepal, including the Rolpa districts, where the maternal mortality is still high. And that is the reason why it's almost clear now that we are not going to achieve our Millennium Development Goal in 2015, that is target maternal mortality rate of 134 in 100,000 live birth and the target institutional deliveries of 11. As you know, maternal mortality depends upon multiple factors. However, we found that in our district, maternal death occurs Most maternal death occurs due to direct obstetric complications like postpartum hemorrhage and toxemia of the pregnancy. And we concluded that timely intervention could have been prevented all this maternal death. So maternal timely intervention are not provided because of the three types of delays: deciding to seek care, delay in identifying and reaching the medical facilities, and finally delay in receiving adequate and appropriate treatment. And cell phone can be a tool to facilitate pregnant women and their families in deciding to seek care, in identifying and reaching the medical facilities. We choose cell phone as a tool because, like in other countries, Nepal has seen a phenomenal growth of mobile telephones in recent years. There was more than 100% increase in mobile phones per year, and there were already 2.7 million GSM cell phones in the country and 716,000 CDMA cell phones. And actually we did a small survey in our district, and we found that the percentage of mobile phone user in the districts is around 30%, and the availability of the mobile phone in a household is 87%. That means in each and every household, almost each and every household, there were one telephone, mobile telephone. We started our program with the enrollment of the female community health volunteers and providing them small training, a short-term training on how to send SMS to the district hospital and how to identify the risks of pregnancy in the pregnant women. In district hospital, there are two types of activities was made. The first one is we set up a central database system with all necessary equipment needed. And second, we establish a task force consisting of medical doctors, midwives, and the nurse to look after this project. So the project started as the female community health volunteer started to send the SMS of number of pregnant women in their village and the sign of high risk pregnancy to the district hospital. District hospital processed all this data. District hospital invited all these pregnant women to have ANC visit in their nearby health facilities, and finally district hospital also disseminate the health education to the pregnant women. And in district hospital, the pregnancy are broadly divided into two types of pregnancies or two categories of pregnancies. First, normal pregnancies, and the second is high-risk pregnancies. And the high-risk pregnancies are very closely followed up. And the task force went to the home of the pregnant women, if necessary, to convince her to seek medical facilities. The number of the pregnant women and their danger signs were collected, and they were sent to the tertiary health care center in capital, and the free referral system was set up to bring these pregnant women to the appropriate health facilities. So at the end of the project, we found that around 90% of pregnant women started to attend the ANC visit, and institutional deliveries increased up to 20%. So use of mobile telephone in healthcare system is not new phenomenon, and it has been tried in the different part of the world. Few examples: in Philippines, in Peru, and in Tanzania, in the island of Zanzibar. And all of these projects shows encouraging result. So at the end, I would like to say that incorporation of the technology in the health delivery system is very helpful, or can be very helpful in the country like Nepal to achieve our universal goal, healthcare for all. Thank you for your kind attention.